Okay. Angie, you might have to unmute yourself, but everybody is muted and we are recording and ready to go. Angie.
Good morning, everyone. Good afternoon for those in the East. Good morning to those in the West. Thanks for joining us today. We are going to have another webcast, I'm sure. We're working out the details. There's so many things changing so rapidly. We will send out an invite as soon as we have that established. Please make sure everybody out there has muted themselves. Sometimes this doesn't allow that. Alex, go ahead to the agenda, please. Hi, everyone. Please make sure to mute your phone line. We're getting a lot of feedback. Alex, I'm not sure if you can mute. Everyone for joining. Our agenda is as follows. We're going to do a brief introduction here in a moment. We're going to talk about some HIPAA, FMLA, unemployment, the pending legislation. I was hoping to see the vote occur last night, but it has not. I know that there is much uncertainty right now. This is certainly a very challenging time around, the health of our people, our economy today and in the weeks to come. So our goal really is to provide information and education on some of the areas that we are hearing are concern for businesses out there. And although I may not be able to answer all of the questions, we'll certainly be continuing to work diligently at Navigate in order to provide updates regularly. Certainly questions that are asked during the presentation, if you can use the chat box in Teams, great. If not, please feel free to send an email to Alexandria. She's keeping a tally of all the different questions. We want to make sure we do get those answered to you within the next couple of days. Go ahead, Alex, and go to the next page for me. Perfect. So as we stated earlier, this webinar will be recorded. We know that not everyone that wanted to attend is able to attend. So this meeting is being recorded and we will distribute that or post it online. Please make sure to mute your line if you haven't already. If you're dialing in on your phone, please don't put this call on hold or it will possibly end up playing hold music for us. And again, your questions can be submitted via the chat box or via email. We'll get to as many questions as we can today. However, what we can't get to or what is going to require additional research, we certainly want to make sure that we're answering everything that we can. Alex, go ahead and for me. Perfect, thank you. For those of you that don't know who we are Navigate HCR, full service compliance and consulting company. Our team is a group of experienced human resource professionals, compliance specialists, and many of us are also former brokers. So hopefully what we're going to bring to the table will answer some of your questions around the ever-changing world that we're living in today due to the coronavirus. Go ahead, Alex. For those of you who don't know me, I'm Angie Sura. VP of Compliance for Navigate HCR. I do lots and lots of speaking events. Unfortunately, this is not going to be one of the more fun, but hopefully it's something that you will find beneficial. Please take note of my email address. Alexandria has been sending out invites for this, so you should have her email address as well. We are certainly here to be a resource to you. So let's go ahead and dive in. So first and foremost, I want to start with HIPAA concerns. HIPAA, as you should be aware of, is the Health Insurance Portability and Accountability Act. This law is really designed to provide those privacy and security standards. A lot of times we think about HIPAA in relation to your doctor or your hospital, but HIPAA really is a concern for all of us in the course of our business, as an employer, as an employee, handling HR tasks. So with everything going on with regard to the coronavirus, it's important, especially when we're looking at transitioning a lot of our workforce into a telecommute kind of role. It's very important for our folks out there who are handling private health information of our employees. So whether you are a healthcare provider or your health plan is self-insured, you're handling the HR for your own business, it's very important that you're protecting that information, especially if you're accustomed to working in your office and are now required to telecommute. Be very careful. When it comes to transitioning employees to a telecommute type of role, and I know as a nation, we are all working very diligently to make sure that our employees can still perform the essential functions of their jobs. So telecommute is becoming a necessity lately. So I wanted to just bring up a few items for our employer friends out there when you're transitioning those employees to telecommute. Make sure if you're providing them computer equipment, laptops, or things of that nature. If you don't have a telecommute policy currently, it's something you want to get working on creating. The security of your information for your place of business, it's important that that is secured. Contact your IT department or your IT vendor if you're not sure how to prepare that. We heard recently that an attempted hack occurred for HHS, Health and Human Services. Our own IT department has provided additional training for us as well and sent out a lot of good information. What is a little bit scary is things like this when we're in a state of panic and we're in, a pandemic, that hackers out there will continue to try to use their skills for evil and not good. And sadly, it is going to ramp up. So you must be very careful. Be very careful of increased phishing emails for your workforce that you're allowing to telecommute. It's very important that we make sure we have some sort of two-factor authentication. Document all of the equipment that is going home with your employees. Make sure you've got all the security measures up to date for any VPN or work applications. And certainly for employees when they are telecommuting, if they're required to use their own personal computer because laptops aren't available, that's something that your IT department needs to be aware of. In the course of working from your home to do your job, be sure that if you're using a personal computer, that your antivirus is up to date. You're locking your computer when you walk away from your desk. Be very careful of the conversations that you're having that other family members may be able to hear. So these are just things that we want to make sure, you guys are all aware of, especially with this mass transition into telecommuting. Now, we did hear from the president, oh gosh, I'm not sure if it was last night or the night before, that some of the HIPAA requirements for physicians and hospitals are being relaxed a little bit. And really the only reason for that is because of the push to use telemedicine. Obviously, if you are familiar with telemedicine or you offer that to your employees, it's going to be critical that they are reminded of that feature and that they're using that. So, some of the penalties for HIPAA are being relaxed a bit for physicians, but please know they are set to a much higher standard than a traditional employer. So they will still continue to be protecting your information. Something of interest when we talk about HIPAA and how are we able to disclose information, because we're in a pandemic crisis right now, it's important to understand that, we do have to talk to our government officials, especially as new cases come out. So if you wonder, how do we know how many cases have occurred in our state or in the nation? Anytime there is a test, those things are documented. So obviously we're keeping the information about our employees private, but we do have to consult with the proper public agencies. Alex, you can go ahead and switch to the next slide. Huge topic of conversation are leaves and layoffs and furloughs, of course. I want to talk about first the issue around FMLA, Family and Medical Leave Act. So whether we're talking about the federal act or the various state acts, there's a lot of questions coming out regarding, is this considered a serious health condition? Normally, your traditional flu is not considered a serious health condition right away. What can trigger it as a serious health condition is if there is an inpatient hospital stay or continued treatment by a healthcare provider. The Department of Labor has issued some interim guidance with regard to FMLA due to the coronavirus. What they're saying is, as listed here on the presentation, workers who are ill with pandemic influenza or have a family member with influenza are urged to stay home to minimize the spread of the pandemic. Employers are encouraged to support these and other community mitigation strategies and should consider flexible leave policies for their employees. If you haven't already started doing so, it's going to be very critical that you begin reviewing your current leave policies. Things are changing rapidly, and in a couple more slides, we're going to really dive into the pending legislation. And we're going to talk about what is coming down the way with regard to leave of absence. A lot of interesting things here, but for now, because this legislation has not passed, now the Senate is looking to vote at some point today. We don't have any time of day that's going to happen, but it should be today. The Department of Labor has issued this temporary guidance. Alex, go ahead. Right, perfect. So certainly, as I just mentioned, it's very, very important that you review your sick time PTO policies. Some of the guidance that I have seen out there with regard to updating or amending the current policies would be the option of maybe offering unearned sick days, for up to 14 days. The government, both state and federally, are really emphasizing the social distancing, closing non-essential businesses. This is getting very, very confusing for all of us, really. So please review your current policies and consider updating them. I'm going to have a lot of information for you on the pending legislation that may help, but certainly we're here to assist in any way we can as new things come out. Some other things to consider is preparing and distributing really concise information to your employees. Employees are really looking to you for guidance. There's so much out there in the media, but their immediate concerns are for their place of employment now. So it's very important that you're communicating regularly. Employees tend to get very upset or nervous if they're not getting regular information, and certainly the goal is to try to mitigate any panic, keep them calm, let them know that you're staying on top of things. So another item to consider is, who do we consider out of our workforce essential versus non-essential employees? That's something that you should begin to look at as more states are enacting various tactics for trying to keep everybody safe. It's important to know, really have a great handle on your own workforce, your own industry. So aside from just who's an essential employee versus a non-essential employee, what is an essential business versus a non-essential business? Certainly, it's not a bad idea to redistribute your PTO and leave policies. Again, it's a situation where, yes, you've probably provided that information to your employees previously, but in a situation like this, just providing it again to them, and certainly if you're going to make any updates, you want to look at doing that. The CDC offers some health and safety practices. There are a lot of one-pagers out there that you can be posting around. And I really want to caution you on avoiding denying time off to an employee when it has been accrued. I know I've heard some situations and consulted on a couple situations already with regard to an employee who is frightened, or an employee who cannot afford to pay for daycare right now and work, wanted to take a couple weeks vacation or a week vacation. You've got to be very careful. Certainly consult with counsel. I am not an attorney. I do not pretend to play one on TV. All I can say is, if there's ever a question, please consult with legal counsel as to what is and is not permissible when it comes to denying an employee their PTO that they've earned. Some additional guidance, and I am going to give this guidance based on what we're going to learn here shortly about the pending legislation. Is certainly, if you're in a situation where your business has been impacted so greatly that you cannot keep the doors open, or where you are not allowed to keep the doors open based on local laws or federal laws, things like that, with regard to this pandemic, that's a little different story. For now, because we hope to have some really groundbreaking legislation passed very soon, it would be our recommendation: avoid terminating benefits to employees prematurely. Now, I know if you are looking at doing a layoff, you're reducing hours, things like that. Generally, benefits are going to last until the end of the month. that's the general practice, and hopefully we'll have some new legislation passed before the end of this month, but you never know with the government. I'm very pleased that they're working together, regardless of party affiliation. They're really working together to put out some very fast legislation to support our businesses, our employees. You know, a lot of good things are in the works. If you are terminating an employee or you know, something of that nature, please be sure to provide your COBRA paperwork immediately. This is one of those situations where, you know, this is a health crisis. So we want to make sure we are as quickly as possible providing the COBRA paperwork if in the event we have to do terminations or layoffs, things like that. Please be very, very careful of state and federal WARN laws. This is the Workers Adjustment Retraining Notification Act. The federal law is in place, but states have what are called mini WARN laws. And what this means is in the event that there is a mass layoff. Now, generally, with the Fed, it's if you have 100 or more employees. Some state WARN laws go down to 50 or more employees. Some go down to just a percentage of your workforce. So please be very aware of what your state WARN laws are, as well as get up to date on what the federal laws are. There are required notifications when a large population of the workforce is being laid off or having their hours reduced. So we want to be very careful of that. Certainly be mindful of state or local predictable scheduling laws. If you are going to rapidly start changing schedules of your employees, some states as well as local laws have some rules around that. I believe Oregon's a big one for it. So please be very careful. I know that we want to try to mitigate risk. We want to try to make sure we're protecting our employees. Absolutely. Just be aware there are a lot of laws in place here that you know, need to be referenced. Now, I'm going to talk a little bit about the difference between furlough. You can hang on one second, Alex. The difference between a layoff versus a furlough. You know, there are a lot of terms that sometimes we use interchangeably, but that's not always the case. So a furlough is considered to be more of an alternative to a layoff. When an employer is going to furlough its employees, it generally is requiring them to work fewer hours or take a certain amount of unpaid time off. It's a little different than an actual layoff. A layoff is considered a temporary separation from payroll. Now, in the next slides, we are going to talk about unemployment compensation. I just want to make sure that everybody is aware that there are some distinct differences between a furlough and a layoff. Those things are going to be important when we talk about unemployment compensation, as well as what's coming up in the pending legislation. So, you know, keep in mind that there are differences. We've had a lot of conversation at Navigate and done a ton of research as well on the intricacies around furlough versus layoff, and you know, leaves of absence versus the other, and reduction in workforce. We are most likely going to sponsor another webinar very quickly, probably not sooner than Friday, but very quickly we'll be sponsoring another live webinar for y'all to join. And we're going to talk in depth about those pieces because it is something that, I mean, we've got millions of employees that are facing this right now, and employees need to be aware of what kind of guidance can be given to them. Employers need to be aware of what guidance is out there for them, so that we can all kind of work together to get through this the best way we know how, despite the fact that it's changing quite rapidly. I think we had a question out here. Give me one quick second. Just want to take a peek. Okay, so what do you do if an employee isn't comfortable working at this time since their job entails being in public? Do you require them to use vacation, sick, or unpaid time? So currently, that's actually a great question, and I get asked that a lot. And I'll give you my thoughts on this with the caveat that it's very, very important to seek counsel, whether it be from your attorneys, from your Department of Labor state website, things like that. But let me give you kind of a scenario here to help in the interim. I don't believe it is a very good practice to deny an employee the use of their own accrued PTO. It's very rampant of the fear that is out there by the American people. Gosh, every country, I'm sure we're all experiencing some level of fear and uncertainty. Obviously, an employee cannot refuse to come to work out of fear and have that covered in any way, but I would be as lenient as possible if they want to use their own accrued vacation time. That's definitely something that we're going to dive into quite a bit deeper on the next webinar, because we're getting that question asked quite a bit. Now, certainly we have to be aware of, what do we do if an employee has no accrued time off? Do we allow them to take time off unpaid? This is really kind of uncharted waters for all of us right now. And as much as I would love to say, please use your best judgment, you also need to be very aware of what laws are in place that protect employees, whether it be state, local, or federal laws. We've got to be very cognizant of that. My best advice is don't make any rash judgments. Take some time to dig into any legalities, and certainly if you're going to allow an employee to use their PTO, or you're going to perhaps put into place an update to your own leave policy in the wake of this pandemic, that's something you want to be prepared to communicate to all employees. And Alex, I'm going to lean on you to let me know when there are other questions, just because it's moving pretty quickly. But go ahead, Alex, you can flip to the next page. I want to talk a bit about unemployment compensation. So, and there's quite a segment in the pending legislation that we're going to touch on shortly for some definite expansions going on, but unemployment compensation is something that is going to really take an uptick, especially if you're running a business that is one of those industries that you're considered non-essential and have been required to close your doors. So even if it's a non-essential business that you've had to, lay off a bunch of employees, there will definitely be lots going on in the unemployment compensation world. With unemployment during emergency situations, and we're going to cover this here shortly, an employee really does not have to quit their job to be able to get unemployment. There are certainly situations where, the employer has to initiate a layoff, or the government initiates closures. A lot of things are coming into play in this pending legislation to support our American workers. Goodness, the hotel industry and a lot of non-essential hospitality or travel, all of those types of industries are laying off mass amounts of employees. I know that, I think it was last night, I was reading a briefing of the president meeting with some of the big names in the hotel industry, Marriott and Hilton and Choice Hotels and whatnot. It's really a scary time right now with the amount of our workforce that is being laid off or furloughed or whatever. It's becoming very scary. My other advice to you all is please make sure to have at the ready summaries of benefits and coverage for your employees. Because this is a health crisis, employees are going to have even more questions about what do their benefits cover in the event they become ill. If you have telemedicine or teledoc or one of those types of benefits available to your employees, please make sure to remind them that they have that at their disposal. Certainly, if you offer employee assistance plans, make sure employees have that information at the ready. This has caused so much fear and panic to our nation that some of these types of benefits are going to be very important and certainly will give some measure of comfort to all of us out there. Certainly, we want to make sure that employees understand in the event that you're that you have to lay off or your business is required to close, what's the status of their benefits at that time? Do you have something in your traditional policy that says, in the event of a layoff, we'll keep you on the benefits for 30 days or 60 days? And, each state is going to be different. Each carrier is going to be a little bit different. So make sure you're well versed in what your plans and policies state, and certainly reach out to your carriers. I know a lot of insurance carriers are already waiving some deductibles or co-insurance. That's part of some pending legislation as well across the board, but a lot of carriers are already taking it upon themselves to assist in this situation so that we're trying to help really avoid additional financial situations for the American people. Alex, go ahead and change my page. Perfect. So I want to do a brief overview of what the pending legislation looks like. This legislation already passed the House. It is in the hands of the Senate now. What I am hearing and reading and seeing is that despite the difference between a Democrat or Republican, this is becoming very much bipartisan. They are working together really, really well, which gives me great hope for our government that, in the event of a crisis, they really are working diligently to provide some much needed support to the American people right now. These are the divisions within the pending legislation. It's 110 pages long. There's a great 10-page summary out there, which we will be happy to email over to you as part of the other documentation we've provided. It's a great read, and it's got some really valuable information in there. Oh, I'm sorry, I can hear someone. If you could please mute yourself, that would be much appreciated. So these are the pieces within the pending legislation. We are not going to go through all of them. I'm going to focus on a few of the more critical areas in what you're being asked as a business owner, what your employees are wanting to know, how you can counsel your clients and partners. Some of these are really, really interesting. So we're going to dive into a handful of those. Alex, go ahead.
The summary of that, the Coronavirus Response Act is actually already located in the files area if everybody has access to Teams, in addition to sending it out later.
Perfect. Thank you, Alex. So let's start with Division C, the Emergency, Family, and Medical Leave Expansion Act. One of the key differentiating factors between this and our traditional FMLA is they have amended the size. So in traditional FMLA, it's 50 or more employees. With this piece of legislation, it's going to open this particular aspect up to employers with 2 to 500 employees. So previously, if you were an employer with less than 50 employees and not subject to federal FMLA rules and regulations, you will be subject to this. The other change is in traditional FMLA, the employee to become eligible for such benefit would have had to have been an employee for the last 12 months and accrued 1,250 or more hours. This particular piece is for an employee who has been on the job for at least 30 days. So significant difference there. Now, certainly there are going to be, I'm sure, notice requirements, possibly poster requirements. We do not have any details of that yet, but keep in mind there will be some documentation requirements forthcoming. So with the Emergency, Family, and Medical Leave Expansion Act, it's going to be to adhere to requirement or recommendation to quarantine due to exposure to or symptoms of coronavirus, to care for at-risk family member who is adhering to the requirement or recommendation to quarantine due to exposure to or symptoms of coronavirus, and to care for a child of an employee if the child's school or place of care has been closed or the child care provider is unavailable due to coronavirus. That's a significant piece as well. Question was, if I have 700 employees, does this not apply to me? Currently, this is enacted for the small to mid-sized business. If you're over 500 employees, I believe from what I have read and listened to from our government is that generally employers with more than 500 employees have other types of paid leave in place. Now, whether that will change in the coming days of this being just for employers with fewer than 500 employees, I do not know. It's a possibility. Other question, when do you think this emergency FMLA Act will go into force? Part of the actual bill itself states that this goes into force 15 days upon being signed. So even if that gets signed tonight or tomorrow by the president, unless there's a modification made, which could very well be in the next 24 hours, there could be a modification to this pending legislation now that it's in the hands of the Senate. But at this point, the way it reads is 14 days. So it could be 2 weeks yet before this becomes truly available. Alex, if you could turn the page for me. Perfect. So we talked earlier about unemployment compensation. Division D within this pending legislation is the Emergency Unemployment Insurance Stabilization and Access Act. This is to provide emergency grants to states for activities related to processing and paying unemployment benefits under certain conditions. It's going to require employers to provide notification of potential unemployment eligibility to laid off workers, ensure that workers have at least 2 ways to apply for benefits. Obviously, in all of this social distancing, they're going to make this available online or by phone as opposed to the in-person visits. And then notify applicants when the application is received and being processed. Emergency grants for states which experience at least a 10% increase in unemployment. This will be funded federally, fully funded. Question we had, will paid FMLA leave be funded by the legislation? To my knowledge, yes, that is in the works. If they're going to require the employer pay for leave, there will be some funding provided in some way by the government. The goal of this legislation is really to provide some very expansive and enhanced benefits while not putting an additional financial stress on the employers as well. More information will be forthcoming on the Unemployment Insurance Stabilization and Access Act. It's actually a really good read, and I would recommend that if you are a business owner that is going to be furloughing or laying off employees or closing your doors completely, that this is something that you want to provide documentation-wise, provide that to your employees. You know, I'm sure they know that this is completely out of your control. It's out of all of our control. But the more information we can arm each other with, the better it will be. Part of this is to waive that normal 1-week waiting period, which is also great. Alex, can you go ahead and switch? All right, perfect. So the next piece, Division E, Emergency Paid Sick Leave Act. Now this one actually has a sunset provision, which means it will expire on December 31st of 2020. Now, again, let me preface all of this by saying all this pending legislation that we're reviewing right now is again pending. This is the way it passed the House. Now that it's in the hands of the Senate, there could be modifications to it. Now, based on what the Senate leaders are saying, they are not looking to make any adjustments because this is time critical information. Doesn't mean it won't have some modifications, but please note that this has not been signed off by the president yet. So emergency paid sick leave. Before I jump into that, I'm sorry, there's a couple of questions. Minimum number of hours worked under furlough versus layoff for retaining coverage versus immediate initiation of COBRA. That's a great question. I am going to double check the research. I can give you most likely some federal requirements. It may require some additional deep dive on a state level. Alex, can you please jot that one down for me? Other question, what if an employee has already exhausted their FMLA in the last 12 months? I believe yes, this is going to be a new allotment. All right, let's talk about Division E, Emergency Paid Sick Leave Act. Again, this one has a sunset provision. So here we are again looking at protecting the small, mid-sized business, employers with fewer than 500 employees, as well as government employees. It's to provide employees with 2 weeks paid sick leave at the employee's regular rate of pay to quarantine or seek a diagnosis or preventative care for coronavirus. It's 2/3 of the employee's regular rate if they need to go out for caring for a family member, whether it's for the family member's illness, or to care for the child whose school has closed or child care provider is unavailable. Full-time employees entitled to 2 weeks. Part-time employees would be entitled to the typical number of hours that they would have normally worked in a typical 2-week period. I'm sure there's going to be additional guidance on all of this once it passes. We will certainly keep you all apprised of what that looks like. Question, are public school employees considered government employees? Traditionally, they are, but you would want to take a look at the state that your school is in. Those can vary a bit. So, please take a look at your state's rules around that. Alex, if you could go ahead and switch. And again, everybody, don't worry. All the questions that are being posted in our chat box, as well as those that are being emailed, we will put those all together on a one-pager and distribute those out to everyone so you all have the answers to your questions. And again, some of these questions, this is so new for all of us that we are going to need to do a little research on some of it as well. And some of it we may not have an answer to until some further guidance is provided. Let's take a look at health provisions. This is Division F. As I said earlier, there are many carriers who are doing some waiving of copays or deductibles in and around coronavirus treatment, testing, things like that. This bill will make it a requirement so that there's no cost coverage for testing, whether it be the cost of the provider, the urgent care center, emergency room visits to receive that testing. Waiving cost sharing under Medicare for certain visits relating to testing for coronavirus. Waiving of cost sharing under Medicare Advantage program. Part of what's going on in the pending legislation is really a big uptick in telehealth options for our Medicare friends out there. We certainly want to, and as you've heard, I'm sure numerous times in all of the press releases and news footage, that it's very important for our senior citizens to remain indoors and not come out if they don't have to, not come in contact with the public, because they are certainly at greater risk based on age or underlying health conditions. So telemedicine is something that is going to be really pushed for our Medicare folks out there. Question, is hospitalization included in Division F at no cost? I don't believe that is going to be covered at no cost. That would have to fall under assuming their carrier or their insurance carrier's benefits. This is more to assist with deductible copay out-of-pocket items that the American people would have to pay. Not a ton of guidance on that just yet. Certainly Medicaid and CHIP recipients, they want to have no cost sharing to those individuals. TRICARE, our veterans, military folks, they're definitely putting a lot of additional features in for that. Emergency increase to federal medical assistance percentages, increase in Medicaid allotments, and again, as I said, changes to telehealth provision for our Medicare folks out there. So a lot going on. Question, if carrier plan has definition of 30 hours as an actively working employee versus minimum hours, will this hold during this time? I do not know the answer to that yet. I will definitely do some research and see what I can find. Alex, go ahead and turn the page for me. Okay, so here's where we're going to come into some tax credits. How are employers getting paid back for providing the mandatory paid sick leave. Division G, tax credits for paid sick and family medical leave. This also has a sunset provision, ends December 31st. What they're saying is refundable tax credit equal to 100% of qualified sick leave wages paid by an employer. There's a distinction between qualified sick leave wages paid with respect to employees who self-isolate, obtain a diagnosis, or comply with a self-isolation recommendation with respect to coronavirus. More guidance will absolutely be coming out on this aspect. They are capping the amounts paid to employees, so $511 per day is the cap. $200 a day is the cap if the employee is out caring for a family member or a child whose school has been closed. There will be a lot of guidance required on how to report this information in order to get the tax credit. There are credits for certain self-employed individuals. I was excited to see this piece come out, but it's definitely, you know, a need. We have a lot of self-employed individuals out there, you know, who typically would receive no benefits. So this is, I think, a great add to this as well. Alex. Question was, can you confirm how we'll get the sample telecommute policy? Absolutely. We will be providing that out to you guys via email. I've got about 5 or 6 types of communication drafts or templates, as well as this telecommute policy and a few others that may be of benefit to you. We are going to share all of those with you as well. So as I was preparing this information, and I'm sure you can imagine it, I've been working on it nonstop because it's changing so rapidly, you know, almost moment to moment, it feels like. But there's also now a coronavirus stimulus package. This is being talked about heavily, and certainly in response to all of the employees who are getting laid off, or, you know, businesses that have to close. It's really a wild, unprecedented time right now. But part of the stimulus package is $1 trillion to workers and their families to provide a more direct assistance. And really, they are talking about sending money to the American people. I've seen a variety of amounts of what this money could be. Nothing has been really provided by any government authority yet, but they know that, you know, a lot of our workers, especially if you think about those who are paid hourly, or those that are paid just on tips, or, you know, a lot of the American public are living paycheck to paycheck, day by day. And gosh, this money could mean quite a bit. How they will determine who gets it, how it's going to come out, I have no idea yet. We will keep you posted as we hear. We talked earlier, telehealth services for Medicare at no additional cost, and they are relaxing the HIPAA penalties for physicians, really around the facilitation and use of telehealth services. Fast food industry. It's very refreshing to see, you know, the various huge entities that have reached out to our president, to our government, about how they can help. You know, a lot of the fast food industries have apps that you can use to order. You know, obviously they've closed their doors, but they are open for takeout. So, you know, they're really working together with our government to support our people. Certainly, the government's trying to ask that we limit our contact for 15 days. That 15 days started on March 16th. They really want everyone to stay in their own home as much as possible to try to stem the outbreak a bit. Obviously, the president has been very vocal about asking everyone to do their part to try to flatten the curve a bit. Previously, it was stay out of, social gatherings of 100 or more. Not even 48 hours ago, it was 50. And now it is keep your social gatherings to less than 10. I know that gets challenging when you think about your place of employment and, how close in contact are employees to each other. Obviously, it's very common to have an office environment that has more than 10 individuals. So it's something to think about how we're going to address that in our own place of business. And we really anticipated some guidance coming out by the IRS with regard to different reporting that's required right now. At Navigate, as you know, we handle the 1094 and 1095 reporting. So we were anticipating an extension of that. Now, we haven't seen that yet, specifically to that particular filing, but we also know that April 15th is the deadline for everybody else in their business or personal taxes. The IRS is asking that you still file your taxes as normal, if that's at all possible, but they are going to defer tax payments that are owed for 90 days with no interest or penalties. They're also, so that deferment is up to $1 million for an individual, up to $10 million for corporations. So little bits of help are coming out in the stimulus package. It's actually an interesting read as well. Unfortunately, there is very little documentation out about this. A lot of what I have gleaned was by literally listening to the president and our government talk about it and what the plans are. So much more information will be provided as it unfolds. Alex? Go ahead and turn my page. Perfect. So some key takeaways for everybody. Our local, state, and federal governments are moving at an unprecedented pace right now on issues that are of the utmost importance to all of us. Hold on to making any rash business decisions, if at all possible, that would be detrimental to your employees, unless, of course, required by government ordinance. Seek support and counsel if you need to make some drastic changes. Please communicate regularly with your employees. Again, they are coming to you for guidance, for support, for questions. Plan for additional required conversation that's going, or required documentation that's going to be coming out that you will need to quickly distribute. Leverage your resources to support each other. At Navigate, we are here to support you in the best way we know how with our skill set, and that's by providing information and education as quickly as we can. Do not hesitate to reach out to us. Please pay attention to reputable sources. Be careful of what you read on social media. Go ahead, Alex. Can you take me to our resources page real quick? So these are some key websites that will provide you a lot of credible websites, resources. The CDC, the White House, the WHO, as I like to call them, the World Health Organization, Health and Human Services, CMS, the United States government, and certainly your state.gov website. Those are critical resources. You can set up alerts through Google Chrome. You can subscribe to those websites for up-to-date and quick information. Again, be careful of some of those other pieces of information out there. And last page, I think, Alex. Again, do not hesitate to reach out to us. Again, I'm Angie Sura, happy to be of assistance. Thank you, Alex, for assisting with our presentation and recording this webinar. Dr. Kale, our esteemed founder and CEO, and Gillian David, if you've not met Gillian, she is our care team manager. We are all here to support you guys in this unprecedented time, and we will continue to provide information as quickly as we get it, and we will be working through very credible sources because we know there's a lot of craziness out there. Follow us on social media. We will post a lot of good things out there as well. And certainly when we're going to have the next webinar, you may see it faster on our social media pages. I thank you all very, very much for attending. I hope that you find some benefit, and we will certainly let you know of our next webinar. Again, watch for us to provide you with a copy of this recording as well as some other documentation and the questions that you have asked. Thank you guys again. Please continue to support each other. God bless.